Good morning and a very warm welcome, everyone. This webinar topic will be focusing on palliative care research network series. These are set up a relatively small group events to allow colleagues to share their research and expertise on research topics of interest to our networks and to provide a space for discussion in a supportive environment. Webinars are recorded and available on the PalHub Professional and shared widely, often large numbers of views over time. If you would like to enable captions, please do so at the bottom of the screen. And please keep yourselves on mute during the presentations. And please rename yourself so that everyone can see your name. Turn your camera off for the presentation, please. And if you need assistance, we will help you. Q&A section will be at the end, but feel free to put in chat at any point. We will be recording only the presentation section, not Q&A section. We are delighted to introduce our guest speaker, Katie Payne. She will be sharing her expertise on the EU-funded palliative care research topic. Katie is a research and project officer for the European Association for Palliative Care based in Northern Ireland. She has worked within specialist palliative care since 2004 as a clinical dietitian, a lecturer, and a researcher. Her role within AIIHPC is mainly focused on the organization and management of the AIIHPC involvement in European Union funded projects and other research activities, leading the EU projects team. Katie's research interests include palliative rehabilitation, cachexia, nutritional support, interprofessional working, e-learning, and knowledge transfer and exchange. She is the creator and facilitator of the Palliative Rehabilitation Facebook group, which has over 3,600 members from across the world and is an associate editor of the Journal of Cachexia, Sarcopenia, and Muscle. Katie, please, you can.
Thank you so much, Frusha, and I'd really like to take the opportunity to thank the All Ireland Institute as well for inviting me to speak to you today. Many of you may know that I also have a history with the All Ireland Institute. So I was the Programme Manager for Education between May of 2016 and May of 2022. So I have a very warm spot in my heart for the All Ireland Institute of Hospice and Palliative Care. So really what I've been asked to focus on today for you is a bit of a whistle-stop tour around EU-funded palliative care research and my insights from working in the EU projects where AIIHPC has been a partner. So I'm going to start with a shameless plug for those of you who aren't just so familiar with the AIIHPC and what we do. So the AIIHPC is the European Association for Palliative Care. Through all of our activities with our members and with the wider palliative care community, we aim to speak with one voice and one vision to support and promote equitable, timely access to palliative care across Europe and beyond. Whilst promoting this collective approach, we also consider the social, cultural, economic, and legal variations which impact our members, enabling us to help and support them appropriately. We're recognised by the Council of Europe and registered on the European Union Transparency Register. So that provides visibility and accountability to all our activities and interests. So we're a forum for all of those working in or with an interest in palliative care. And we influence, promote, and advocate for the need for high quality palliative care wherever it is needed. And we share palliative care education, research, policy, and evidence-based practice as an organisation. You can go on to the EAPC website and learn a lot more about us, but just in terms of our vision is, again, that palliative care should be accessible and available to everyone, whenever and wherever they need it. So it shouldn't be inhibited by age or geography, by where they are in the country. They should be able to equally access it. And our mission then is, through education, research and advocacy, we strive for improved, timely and equitable access to palliative care, ensuring it's an integral component of health and social care. And these are our core values. So it's about excellence in clinical practice, education, research and policy. It's about supporting interprofessional representation, because palliative care is primarily a holistic interprofessional specialty. It's about ensuring equity, diversity and inclusion. It's about ensuring integrity and transparency in the work we do. It's about collaboration, and it's about ensuring that palliative care and our organisation remains sustainable. We currently have 63 associations from 36 countries that we represent. 53 of those are within Europe, but we also have 3 member organisations in Australia and New Zealand, and most recently we have 1 Canadian association as well. And we also have individual members from across 55 countries across the world. This is a very core part of the job of the EAPC, is supporting the EAPC Atlas of Palliative Care in the European region. And this was launched recently at our Congress in Helsinki. You can scan the code to get a free downloadable copy. It is massive. If you wanted to print it out, it's 531 pages A4. It's a lot of information. It is also available to buy. But what the Atlas does is it really showcases what's happening in palliative care across Europe. And in doing so, it helps us to identify gaps, to foster advocacy, and to support inclusion of palliative care as a component of universal healthcare across Europe. If you're not already a member of EAPC, of course, I'm going to encourage you to be so. Joining the EAPC, you can join as an individual member for access to voting rights and to support the organisation. But you can also join us completely for free if you are a member of an organisation such as the All-Ireland Institute of Hospice and Palliative Care, the Irish Association of Hospice and Palliative Care, the Association for Palliative Medicine, the Association of Palliative Care Social Workers. There's also the International Association of Nurses in Palliative Care and the Association of Paediatric Palliative Medicine. So if you're a member of any of those, you can join the EAPC for free, but you do have to go to our website and join as an associate member to get all of the access as a member. So that's all the shameless plugs about EAPC. And what I'm going to move on to now is discussing really the meat of today's presentation, which is about EU-funded palliative care research. So again, as many of you hopefully know, EAPC is a core partner in a really large range of EU-funded research projects. And primarily we are there to provide support for knowledge transfer and stakeholder engagement. And often as well, we are there to provide another voice for palliative care within maybe teams who have more expertise from a topic specific base, so maybe a disease specific base, rather than being purely, having the full understanding of what palliative care is. So through EU funding, through Horizon, through other funding streams such as Mission Cancer, Erasmus+, EU for Health Cost Action, this funding is instrumental in advancing palliative care. Each of these projects addresses a crucial gap in palliative care provision, and they all have the potential to greatly improve palliative care. As I mentioned, EAPC does provide a key role in dissemination, helping ensure that the findings of this research and also the incidental findings, so maybe not just the what was intended from the research, but the other things that we find when working in partnerships in these projects, that these important findings reach clinicians, patients, families, the wider public, policymakers. It's not just about reaching academics or researchers. And we do that through the effective knowledge transfer and stakeholder engagement. I could talk all morning about all of these projects. As you can see, there's an awful lot of them. But rather than that, I'm going to give you a very, very, very brief overview of what each of these projects are. And I really encourage you to go on to our website, the palliativeprojects.eu, where you can, from there, all of these projects are easily signposted. So if any of these pique your interest, go on to that website and go and have a look, a little bit more of a look at what these projects are all about. So I'm starting at the top with the Horizon Europe projects. So the Horizon Europe projects, which began in 2022, are focused on palliative care, specifically for advanced cancer. So PAL Cycles is developing a transitional palliative care program for patients with advanced cancer. And the aim is for this to be adaptable to local cultures and healthcare systems. So it's about supporting people who are diagnosed with an advanced cancer in hospital, supporting them in the transition maybe from more of a cancer-focused care to a palliative-focused care, and supporting them in the transitions from moving from hospital out into community and maybe back again, depending on their needs. EU Navigate is implementing and evaluating a navigation intervention for older people with cancer and their family caregivers. So this is about developing up skills in volunteers who walk alongside people who are older with an advanced cancer and support them and their families in being able to navigate systems, being able to get the care and the support and the social networks and all of the things that they need to support their quality of life. Painless is investigating pain relief in palliative care using home-based neuromodulation. So it's like pens for the brain and predictive biomarkers. So we're also looking at, are there ways of predicting what sort of pains might be more likely in different types of patients with different types of cancer? Inspire is testing a rehabilitation-led short-term service to improve quality of life and equitable care access. So again, the emphasis of that is about supporting people to manage to do the things that they want to do. So it's about enablement and empowerment through a rehabilitation lens. MyPath is developing and implementing innovative patient-centered care pathways and supporting their integration into the infrastructure of a cancer centre through the electronic means of gathering information about patient symptoms and their trajectory of their illness. So those are all the projects from 2022 that were focused on cancer. In 2023, then there was a call that specifically looked for projects that were non-cancer. And it was a recognition that palliative care is not just about care for people who have advanced cancer. So In Touch is led by a team in Cork, the University College Cork. They're implementing a person-centered palliative care intervention to improve comfort, quality of life, and social engagement of people with advanced dementia in care homes. And another project that's looking at dementia from a slightly different angle is AI for Hope, which is developing artificial intelligence-based health, optimism, purpose, and endurance in palliative care for dementia. So these are people who are still living independently, and it's about providing them with electronic applications that enable them to manage more effectively their day-to-day lives at home. Palliative is a a comprehensive paediatric palliative care project. So really in that project, what we're aiming to do is to provide a similar level of support for children that adults routinely expect from palliative care. So it's looking at, what things can we learn from adult services that we can apply to a children's setting. And it's everything from earlier recognition of children with non-cancer palliative care needs that could be supported with a palliative care approach early through better identification. It's about symptom management. It's about advanced care planning. It's about training of healthcare professionals. So a very, very comprehensive project based on children. EPIC is examining the use of telepalliative care for individuals who are in intensive care units across Europe. So it's supporting intensive care specialists to consider the palliative care needs of patients who are in their ICU beds and using the support of palliative care remotely through telecare. SciPal is using psilocybin, which is the active component of magic mushrooms, to support therapy for people who have psychological distress in conditions, so various neurological conditions and patients with COPD. Raphael is integrating a palliative care approach for patients with heart failure, and again, using sort of technology and apps in that to support patients with symptom control, with better earlier reporting, and about training and supporting staff. And EUPAL COPD is again looking at supporting, and it's actually supporting an existing intervention, the iClear EU intervention, to integrate palliative care into the treatment of people with advanced COPD and their family carers. So again, it's about better symptom support to train up staff who are working within respiratory, and support for more purposeful advanced care planning. The Horizon 2020 projects, and all of these are now completed, that we were involved in, include DIADIC, which evaluated a psychoeducational intervention for people with advanced cancer and their informal carers. And it was looking at both support that came from nursing staff, so trained nursing staff who went in to support patients, and a nominated person that they chose to be their informal carer, and compared that to an online electronic version of a similar training sort of dyadic program. MyPal was developing an electronic-based patient-reported outcomes system for adults who had hematological cancer and children who had both hematological and solid tumours. And again, the focus was in about supporting patients to report outcomes, to report their symptoms earlier, and for earlier integration of a palliative care approach to their care. Palliative sedation investigated the use of palliative sedation across Europe. So that was both sedation at the very end of life, and sedation for relief of symptoms for patients who had advanced cancer. So it was all about the relief of refractory symptoms. I'm going to talk a little bit more about that in a minute. And then, as part of Horizon Mission Cancer, EU OnQual, and this is an ongoing project, is a co-designed project looking to globally assess quality of life of patients who are undergoing cancer treatment, those who are survivors, those who are who have advanced cancer, who are no longer in treatment, and it's about looking at the quality of life on a global perspective. So it's not directly to benefit that patient who is submitting their information, but to look at benchmarking and improving care for patients with cancer across Europe by looking at how quality of life differs, and then investigating what way we can improve quality of life across Europe. Erasmus Plus, many of you will know again, their European Union flagship programme for education, training, and also youth and sport. So Nurse EduPal, there have been 2 iterations of Nurse EduPal through Erasmus Plus. The first one was in developing a curriculum for undergraduate nursing students for palliative care competencies. And the current iteration, which is Nurse EduPal Impact, is really looking to support nurses who, as leaders of improving palliative care training and education across Europe. VR Talks, which just finished last week, was investigating the use of virtual reality to support communication skills in the developing those communication skills initially for undergraduates, but with the intention that it could be used to support training and continuing professional development of healthcare professionals around breaking bad news. RESPAC was a project that was aimed to develop basic research competencies for people who are not researchers but would like to be. So it's all about supporting people who are working within palliative care to understand more about research and to feel more confident to take part in research studies as a co-designer, or perhaps to be more involved as a researcher. And then as part of EU for Health, there is a project that again has recently finished, which was Smart Care, which was developing a mobile app to improve the health and well-being of cancer survivors. And we have hoped that this again there will be a further project coming from that will look at at evaluating that app further. Interact Europe, again, there are 2 iterations of that have come through EU for Health. The first was about developing an inter-specialty cancer training, and our involvement in that was to ensure that the palliative care training was effectively and appropriately integrated into that interprofessional cancer training. And this training curriculum and the online materials are now being tested in 100 cancer centres across Europe, and perhaps some cancer centres, I think some cancer centres within Ireland are involved in that. And then last but not least, we have a cost action project, which has been developing an evidence-based self-assessment tool to evaluate and plan high-quality palliative care education and training in a way that's both culturally and ethically appropriate for different countries. So as I say, a whistle-stop tour, and I'm really happy to talk to you after in the Q&A about any of these that maybe are of particular interest to you, or perhaps ways where you might be using some of these projects or engaging with them. So I also wanted to mention, and it's my career trajectory took me through working as so I worked as a doctoral student in Ulster University, and I was funded through the All Ireland Institute of Hospice and Palliative Care for that. I then worked as a postdoc for Ulster University whilst working also as a lecturer at Our Lady's Hospice and Care Services. And one of the projects that I worked on was MTREC, which hopefully again is not unfamiliar to you as a project. And it's a really, really useful evidence-based model for the transfer and exchange of research knowledge. This is the model that AIIHPC use to support all of the work we do on knowledge transfer and exchange. I find it extremely helpful because it takes the best bits of all of the research around how to effectively transfer research knowledge. And it breaks it down in a very nice and easy way to understand and to explain to other people who work in our consortiums. So it is about thinking about the messages that need to be transferred, and they can be both the messages that come at the end of a project about the final findings, but equally they can be messages about other things that we find, as I say, incidentally along the way. It's about ensuring that you have a really good grasp of who the stakeholders are that you need to influence, and getting to know them really early in the process so that they are ready to hear when you've got important information to share. And it's about considering the processes by which you reach those people. So what sort of, what ways can you engage people early? What sort of, who are the opinion leaders that you need to get on board? Who are the people that ultimately will decide whether the research finds footing in clinical settings? You need to consider the local context in which people work, and the social and cultural and economic context in which people work. And it's also really important that we evaluate the efficacy of our knowledge transfer and exchange. And that's something that AIIHPC has been actively trying to do over the last couple of years. So we've had a researcher who worked with us, supported by Suzanne Guerin, who was one of the authors of MTREC. And he was working with us to evaluate how we were using MTREC and whether we could be more effective in what we were doing in knowledge transfer. And definitely their knowledge transfer and exchange, it is a process, but it's both an art and a science. So yes, there are technical things, but there's a lot of it that's about how you share information and engaging and giving enthusiasm behind what you're doing, so that people, when the projects do have exciting information to share, the stakeholders, the people you want to influence, should already be engaged in the project, should be ready. And there should be the ability to have those light bulb moments of, yes, I understand. And I can apply this in my own setting. So the AIIHPC, we're all about creating the buzz around the projects. One project I'd said I would highlight is this palliative sedation project, because it's one that was finished quite recently, and it's one that was highlighted by the EU Commission, so by the funders, as one that was highly effective. And showed real promise in terms of the impact that it could provide to palliative care. So again, I've put a couple of links on this slide. One is the Innovation Radar. So this actively looks across projects that are funded by the European Commission, and highlights where there is real innovation and real impact, as I say, that comes from a project. And the second one that I've put the link to is the Nodo. So the Nodo is a general purpose open repository developed under the European Open Air Programme. So it's operated by CERN, which is the EU organisation for nuclear research, which is just an interesting fact. So what was highlighted in particular in terms of real impact from this project, which was looking at the use of proportional sedation, so sedation that would be effective enough to reduce the distress that patients were having that was refractory, that we couldn't manage in any other way. But that you weren't over medicating people, that the sedation was done in a way that was appropriate to the wants and the wishes and the values of the person, either reflected by them prior to getting the sedation or reflected by discourse with the family around what would that person want based on what you know of their life. So there was a real sense from that project that we were able to improve the ethics and practice around palliative sedation through supporting shared ethical decision making that included the whole interdisciplinary team and patients and families through structured moral case discussions. So it wasn't all left at the door of what a single clinician to make the decision whether someone should have sedation or not. By utilising an AIIHPC group, so a task force that was formed as part of the project, we were able to, through a very strong Delphi process, revise an existing AIIHPC framework on palliative sedation. And this new framework, which is openly accessible, offers clear protocols aligning with contemporary standards around how to use palliative sedation appropriately. There was a massive open online course that was developed as part of the project, and an ebook, which was all about increasing the awareness and supporting knowledge, skills, and abilities in palliative sedation practice across Europe and beyond. And we were able then to develop some policy advocacy through the project as well, about informing both EU and national policymakers to support policy integration and broader implementation of optimal palliative sedation practices across Europe. So all of these sorts of impacts you can see on the Palliative Sedation Project website, which, as I say, is accessible through the link that I shared earlier. So I want to move on just in these last sort of 10 minutes or so about some of the tips for how you might go about. So you're interested in being part of an EU-funded project. How do you get on board? And I like this quote from Richard Branson, initially based on business, but I think it's appropriate to projects as well. Research projects, funding opportunities are like buses. There's always another one coming. So how do you make sure that you are on that bus? And I think one of the first things that you need to do, both individually and as the team that you are working in, as the organization that you're working in, is to clarify, put the you in the brackets, your unique selling points, but just your selling points. They don't have to be unique, but what they have to do is to fill a clear gap in a project team. Project consortium don't want people who just duplicate what's already knowledge and skills within the team. They want people who bring something different, something extra. So it could be your ability to access, for instance, a clinical site or healthcare professionals or patient groups. But in order to do that, you have to do the legwork ahead of time. You have to develop those relationships with those hospital teams. You have to sell to them why your work in this project will ultimately benefit them, and their input into the project is of value to both them and to greater society, and stressing that growing recognition that palliative care is an EU health priority, that we are aligning with patient-centred, person-centred care by the holistic way in which we work. Maybe it's about your ability to engage with patient and public. So have you got links to local charity groups, to disease groups, and it's about cultivating those links as well, so that you are able to bring that to the table. Do you have implementation science expertise? Again, this is something that's becoming more and more valued in projects, because EU funding is becoming more and more interested in the so what of the research. It's not good enough just to do good research. What we have to show is value to the taxpayer who pays the money to the EU, and value to the health service in general. Things that can, once the project is finished, things can be changed as a consequence, not just more research is needed. Health economics, again, super important. Just because something can be done, does it create value? Is that value sufficient to offset the costs of the new way of working? Policy expertise, again, super important, because politicians, if you look at what's happening in the wider political landscape at the moment, there's a lot of wariness of, and maybe a push against the norm, against standard healthcare, that we're all in it for the money, that industry's all in it for the money. So you really need to develop the relationships with your local MEPs so that they are on board with why actually the research in this area is super important, and it's not just a money-making racket that we're doing. Really good if there's digital health, big data expertise in your team, because more and more we need to work with expanding digital health sets, data health sets. And as I say, Zenoda will be that open repository. There will be more and more data sets available in that people can use. So having someone who's actually able to utilize that is really, really useful in these project teams. Also someone who has understanding beyond ChatGPT of artificial intelligence. So if you have a project team and someone who is on top of how artificial intelligence can really, really promote and support and accelerate a project's capacities, and it can be everything from appropriate use of artificial intelligence to support literature searching through to data analysis, but there is a real risk of having someone just going in and giving it a go. You need someone who actually understands understands the applications, understands the data protection issues, understands when something, when the output is not right, and knows how to effectively use the systems so that they are appropriate. And I often say to people, to me, ChatGPT is about a bit like Wikipedia was 20 years ago. Yes, there can be useful information in it, but you need to know, you need a good level of understanding to be able to parse what's good information from what's just information that ChatGPT has gathered from unreliable sources. Support for pedagogy. So do you as a team, are you able to support a project to develop training for staff that is accessible across different countries and different languages with different cultures? Do you have the capacities to be able to both develop and share content? Do you have access to massive open online courses, and the capacity to be able to develop those at a competitive cost? Do you have the ability to translate into different languages, the cultural sensitivity? All of these, again, really key skills. And obviously knowledge transfer and exchange. So are you well connected? Do you have great stakeholder, local, national policy? Do you have those links already that make you a really, really good candidate for knowledge transfer and exchange? And also one that I didn't mention, and it's another really big plus for Northern Ireland, the south of Ireland, across Ireland, is having English native speakers within your team can be a real boost to a project team as well. If everyone else has English as a second language, being there as someone who can proofread, who can support the application, really helps, because if the protocol is written by a non-native speaker, sometimes a project can be scored down not because of the science, but because it's not been well articulated. So the next point is around building your visibility as a team, and again, as an individual. So it is about ensuring that you're publishing and you're presenting, not just at a national level, but at an international and a European level. It's about engaging with European networks, both palliative networks and disease-specific networks where you're interested in researching. It's about making sure that you showcase your expertise online. It's no use that only local people know the expertise you have. You need to start playing on a much broader international network through your presence in the web, on your organization's website, through social media, through engaging and creating webinar series, podcasts, things that just let people know that you exist. Also really helpful to think about becoming an expert reviewer, again, in areas where you're wanting to engage in the research. If you review, you get to know what is a good proposal and how can I raise my game. So again, just a few practical examples of this. Maybe think about being an EU Commission expert. So experts assess applications for EU funding. And again, once you assess other people's, it really raises your game. Monitoring EU funded projects and contracts and giving your advice on topic specific issues. So you can go on to the EU platform and register yourself. Becoming an AIIHPC abstract reviewer, again, really helpful to understand what makes a good abstract is if you've scored and understood what good abstracts look like. And also, think practical things like think about becoming a group chair for the AIIHPC. So for a task force or a reference group, or joining a steering committee. These groups produce outputs such as webinars, white papers, tools for practice, research publications, guidelines. And again, it really elevates you on a European level. Network, attend conferences, contact people who are working in projects, follow and share their projects. Think about acting as a third party or an advisor, or a pilot site maybe, where these things won't bring you research funding, but what they will do is bring you a foot on the ladder of recognition that you have something to offer. It's also really, really valuable to get to know your national contact points for funding calls. And I'm assuming all of you will know, for instance, for Horizon Europe, the contact for that was Patricia McQuarrie in QUB. The contact for Ireland, Enterprise Ireland, Dr. Martha Cahill, for instance. So these are really, really important people who should know who you are and who your team are. Another a good example of networking would be something like COJA. So COJA, as I mentioned, is one of the projects we're involved in. It's a different project in that the researchers themselves are not funded to be part of this project. So you're joining this on a voluntary basis, but what the cost action will pay for is facilities for people to meet up in person, and will provide opportunities for people to go to other cost action, to people who are within this COJA project to go and visit them. So it's more practical non-personnel funding that comes with these projects. The project itself started in September of 23. So we're 2 years down on that project. The project ends in 2027, in September of 27. So there's still plenty of time to get involved in it. Why get involved in it? Because lots and lots of really, really recognizable names of palliative care are there leading and pushing forward this agenda, which is about developing culturally appropriate and inclusive assessment tools for palliative care education. So really, we're trying to measure, explore, promote access to palliative care education. And having more people on board is really useful and important. And you can join at any time. You can join any of the working groups. So I'd encourage you to go and have a look at it. So again, just to, as I said to you, the Richard Branson quote, opportunities are like buses, always one coming, so be ready at the bus stop. How can you be ready? So look at your organization, build your internal team of palliative care experts or affiliated experts. Create a profile, a partner profile for your organization so that you are aware of what expertise lies in your organization, what experience, what assets, and then let people know. Subscribe to the Horizon Europe, the EU for Health calls so that you know what's coming in. Pitch your organization to national contact points. Know who the principal investigators are and make contact with them. Go up and speak to them at congresses. Just express interest, that you're really interested in being involved in research, to anyone you think might listen. And think about attending and contributing to sandpit dissemination events. Just get in and get known. Again, a shameless plug, but AIIHPC, we are an effective communication vehicle and we benefit our members by our digital reach. So we publicize and promote members, events and news through our digital contacts. And as you can see, we're not active on Twitter anymore, but we are on Blue Sky, on Facebook, on LinkedIn, on Instagram. We have a newsletter, we have a blog, We have a YouTube channel, so get familiar and see how you can raise your profile through our links by joining us. Key dates for you, so that all of the great and good will be from palliative care will hopefully be in Prague this year, in 2026, so next year. We will have an open call very soon for abstract reviewers, so if you're interested in reviewing abstracts again, just get on board, join us. Really the main criteria we're looking for is people who want to be abstract reviewers. If you're still quite young in your research career, that's not a barrier to joining us. So please think of doing that. And the call, as I say, will come out soon. And then for 2027, we will be in Glasgow. So just to hop across the water. And that is all that I want to share with you now. So I am happy to hand over for any questions or comments that you might have for me. Thank you.